Ethacrynate sodium, also known as a water pill or diuretic, is used to reduce swelling caused by conditions such as cancer, heart failure, liver disease, and kidney disease. It works in the kidneys to increase the amount of urine produced, which can help improve kidney function and alleviate symptoms such as trouble breathing and swelling in the ankles, feet, hands, or belly. This medication should not be used for infants. It is important to follow your doctor's instructions regarding the daily dosage and the optimal timing for taking this medication. When using ethacrynate sodium vial, it is typically administered through a vein by a healthcare professional. The dosage will depend on your specific medical condition, lab test results, and how you respond to the treatment. If you take this medication too close to bedtime, you may need to wake up during the night to urinate. It's recommended to take this medication at least 4 hours before going to bed. If you have any questions about when to take it, be sure to consult your doctor or pharmacist. Make sure to keep your doctor informed about your progress. Let them know if you don't see any improvement or if your condition worsens. Some common side effects of ethacrynate sodium vial may include pain at the injection site, dizziness, lightheadedness, weakness, muscle cramps, upset stomach, or diarrhea. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. This drug can cause dehydration and electrolyte imbalance, so tell your doctor right away if you notice any symptoms of dehydration, such as confusion, unusual decreased urination, unusual dry mouth/thirst, fast/irregular heartbeat, or severe dizziness/lightheadedness. Contact your doctor immediately if you experience serious side effects such as easy bleeding/bruising, vertigo, hearing changes, black/bloody stools, stomach/abdominal pain, vomit that looks like coffee grounds, or signs of liver problems. A very serious allergic reaction to this drug is rare, but get medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice other effects not listed above, contact your doctor or pharmacist for advice. Before you start using ethacrynate sodium, make sure to inform your doctor or pharmacist if you have any allergies or if you're allergic to this medication. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to tell your doctor or pharmacist about your medical history, especially if you have gout, kidney disease, or liver disease before using this medication. Ethacrynate sodium may cause dizziness. Avoid alcohol or marijuana, cannabis, as they can make you even more dizzy. It's important not to drive, use machinery, or do anything that requires alertness until you can do so safely. It's also recommended to avoid alcoholic beverages and consult your doctor if you are using marijuana, cannabis. This medication can lower certain salt/mineral levels in your blood, such as sodium and potassium. Your doctor may advise you to use more salt, eat potassium-rich foods, or take a potassium supplement. It's best to ask your doctor for more details. If you have diabetes, this medication may affect your blood sugar. Be sure to check your blood sugar regularly as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness and water/mineral loss. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding. When taking ethacrynate sodium vial, it's important to be aware of potential drug interactions. This means that the way your other medications work can be affected, or you may be at a higher risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Some products that may interact with ethacrynate sodium vial include desmopressin, furosemide, and lithium. Additionally, some products may contain ingredients that could raise your blood pressure or worsen your swelling. It's important to inform your pharmacist about all the products you are using and ask for guidance on how to use them safely. This includes products like cough and cold medications, diet aids, and NSAIDs such as ibuprofen or naproxen. Always consult with your healthcare provider before making any changes to your medication routine. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, it's crucial to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Before using ethacrynate sodium vial, it is important to have regular medical and lab tests to monitor your kidney function and blood mineral levels, such as potassium. Make sure to keep all of your medical and lab appointments to ensure the safe and effective use of this medication. Ethacrynate sodium vial is a diuretic medication used to treat fluid retention, edema, in people with congestive heart failure, liver disease, or kidney disorders. It helps the body get rid of excess water and salt through urine. This medication is usually given by injection into a vein by a healthcare professional. The dosage is based on your medical condition and response to treatment. It is important to take this medication exactly as prescribed by your doctor. It is usually given once daily, and the best time to take it is in the morning to avoid having to wake up during the night to urinate. This medication is administered in a medical facility and is not meant to be stored at home. It is used to treat conditions such as congestive heart failure, liver cirrhosis, and kidney problems. The dosage and timing of administration will be determined by a healthcare professional based on the individual's condition. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.